Hello guys, this is Dr. Biplav. So welcome to our session after a long gap. And today we will be we will be having a special guest today with us, who will talk about the topic of gender inclusivity. To talk about on this topic, we have with us Dr. Shruthi. Hello, Dr. Shruthi.
Hello, hi.
Dr. Shruthi, what are you doing these days?
I am currently doing my SR-ship in Sion Hospital, Mumbai, in the Department of Community Medicine.
Okay, nice. Dr. Shruti was a junior resident from KM Hospital. So now she is doing her SRship at Cheyenne Hospital. Welcome, Dr. Shruti. So my first question
Yeah,
is
hello.
that what are the norms which are set up by society for both men and women?
Yeah, okay. So in our society, we have like a lot of norms, both genders. So like some are general and some are specific for a female or a male. So coming to like ladies or females, we say generally they have to be passive, they have to be more emotional and caring and very passive type. And then coming to different things like marriage and everything, they have to marry early, make a child, have family. All these things are like set, like a definite age for doing different things. And some jobs are not so good for women. People say such things like we don't know, like there is nothing as such we cannot do, but then they say like female cannot do such and such thing, it is good for men. And reverse is also there. And coming to males, there are many other norms saying like marriageable age, making a family, having to be financially independent by a specific age, so that you have to take care of everyone. And like they have to be more aggressive and more manly, or such things like you cannot express anything. Men are not supposed to cry, they say, so we cannot express out. So it's like opposite, female should always cry, male should not cry. Such things happen. And then about age of marriage, then having family, then a job, all these things are like general things. And especially it's like a black and white thing, female has to be such and such thing, male has to be such and such things. And it varies with different culture, but mostly it is common what we see.
So, Dr. Shruti, so you think whatever men and women, the norms set up by society, they're expected to do or act like that. So it is done by the society. So a woman can also be a fighter pilot. A man can also be a house husband or a cook at a home.
Suspend, yeah, at home. Yes, such things are possible, but then society has just defined us in some circle, which we are just compelled to do. And those who defining are actually both males and females together. It is not like a single gender. They all do it together, and it is being imposed on since generations, like this, just like you said.
Yeah, and even when there is when the child is born and we give a toys like
Yes,
guns
exactly.
and
We
gun.
just select from a very young age. Like we are selecting a color, like a pink for a female, a blue for a guy. So it's nothing like that. Kids can like anything, and even as adults, you can like a man can like a pink color, a female can like a blue color. That can be favorite. And about toys also, girls should be given dolls, and guys should be given cars or trucks, something like that. So there is nothing. It's just defined by the society, and we are training them since such a young age that they also start thinking in that way. It's just instilled at such a young age, the gender norms.
Okay, Dr. Shruti, is there any difference between what we call gender and sex?
Yes, they are actually very different terms, but most people confuse it. So, sex is just basically what is our biological thing. It is completely based on our biology, and it is assigned at our birth, like whatever reproductive organs we have. So, based on that, there is just male and female, two genders, and some are not genders like sex specified also because of their reproductive organs. That is just a special case, but mostly it is like a male or female based on reproductive organ. And gender is something which again the society gives. So based on our roles, behavior, and other things in the society and culture, they are specified into a gender role. Like we say a woman, a man, and nowadays we have other genders also, transgender, trans man, trans woman, everything, which is just based on their roles and behavior in the society. There is nothing biological related to that.
So one person who is biologically male can be that person can may not feel like he is male, and he may get attracted
Yes.
towards male only, or he may feels like he or she is a female.
Female, yes, there is many cases like that where you're assigned a gender at birth, like you have a sex, like you are a female, but when you are growing up, you feel like you are a man, means then your gender is a male, because that is what you feel from inside. So we define it on ourselves. So gender is something which we feel, and you can be attracted to the same gender or opposite gender. It is just all based on our own sexual orientation and things. These are not anything biological, but then what the society and what we feel from inside. So it's all together like that, gender.
So, Dr. Shruti, I think talking about this topic is taboo, particularly in India. So, as we said, one person who can be biologically or physically a male, but that person can feel like a female or a neutral or any kind of thing. So, what should be the role of parents in such cases where the child feels different to what biologically assigned to him or her?
So, like parents, like in such a special case, like you are assigned one sex and you are feeling a different thing when you're growing up into a gender. The assigning thing is different. So, parents have to be very supportive, because the first a child is feeling so discomfortable or anything, first approach will be trying to tell the parents, and they have to be like neutral. Like, first of all, parents need to understand that they cannot define their child, it's what he or she is. Like, so we only thing they can do is be supportive of them. So in India, as you can see, it's very taboo, and most parents are very not supportive and even oppressive of such things. If a child even comes out, also they oppress and say like, no, you are not gay, you are straight, and all those things. They try to press on the kid because of the societal pressure. But actually, we should come out of all these things. So advice to parents would be to just understand. First, understand what is sex, what is gender, what can be a sexual orientation, and everything is possible. Like, a child can be anything. You have to go with that approach, an open mind.
Dr. Shruti, we have heard about LGBT community. So can you explain
Yes.
what does LGBT means?
LGBTQ is a queer community, we say, like a special group where they are like, having a different from the male, like the straight male or female, we say, which is a cis hetero male or cis hetero female. So LGBTQ full form will be lesbian, gay, bisexual, transgender, and queer. So these people, they have a different sexual orientation or a different feeling, like, they are assigned as a special gender at birth, and since they are growing up, they are having a different feeling. So all these together, they form a community. It's all over the world, and they form a community to identify and help each other. And mostly different from the heterosexual males or females who are like attracted to opposite gender, feel falling for the normal societal norms.
Dr. Shruti, what obstacle do people from LGBT community face when availing government services?
So yeah, basically, like I said, it is a big taboo in India. India, even in around the world, also many countries still it's a big taboo, and some countries even are it's like an illegal thing also. We have heard like the new World Cup and Qatar, everything, a big issue is going on, protest. So they are facing like they do, first of all, from the family itself. The parents are not supportive or the family members are not supportive. So they have a mental trauma and other things. So, whatever be it, when you are mentally down or anything, you cannot function properly in a society, and they are not able to achieve what they are capable of. And coming to other government policies or things, they don't get an appropriate identification. See, if you don't have there is always just a male or a female category in everything when you go for any selection. Nowadays maybe they are putting third gender, but still it's not specific. They don't they are not getting proper identification or an ID card to go on to the avail different services, and everywhere they need an Aadhaar card. And when you say you are a, for example, if it's a female and she is feeling like a male, but then she is having different trouble and all, then she is going to a gynecologist and saying all these things, then they shun off her like, you are a male, why are you coming here if you're feeling like a male? But can she go to a other urologist or something? No, because she is biologically a female. So such confusions happen, and they are always stuck in this conundrum to go where. and in most of the cases, and also the attitude of the people when such a person comes to any government or any private sector, they have like a stigma, and they want to just shut them off and not, interact with them, or say, just send them away. That's just the general attitude they are facing. Cut off from the Put out like an outcast and cut off from the society.
Okay, so when there is a mention of gender, so there should be a column for third gender when you are filling any
Yes,
forms in government schemes or something like that.
yes, everywhere.
So, Dr. Shruti, as you are a doctor and you practice in hospitals and OPDs, so why do we rarely see people from LGBT community coming to our hospital?
I think it's both sided because they themselves feel so outcast and so reluctant, like they have been stigmatized toward their life. They are just not open to come out to any facility, even though we may be open, but they are, they have that innate fear. Will we be accepted? Will we get treatment? Will we be heard of, like, other things? And there is another one taboo, like all the queer people are into some sex work and other things, a taboo going on. So such behavior will they face. And also in health facility, just like I said, any other public facility, they need an ID card, they need different forms. And these things are like a difficult step for them to clear because they don't have a proper identification, and many are just run off from their families, and also they do not have any proper documentation. So all in all, it's like, even though we want it from any individual side, the whole system is like that. They have a lot of obstacle from their own point, they have difficulties coming out, and from the health system care, the approach is still not yet like they can just come out freely and do all the checkup or everything. Again, they are just, they will feel like we are being outcast there everywhere.
So, so Dr. Shruti, do you think the work of female sex worker be legalized?
Yes, I think in India, well, even though we do not agree or whatever it is, it is a big thing happening. Like it is common everywhere, mostly in every state, every district. It is a prevalent thing. So there are a lot of people who are working in that condition. So when you make it illegal, the only thing you're doing is you're just pushing a poor section of society again into a poorer form. So they are not able to avail anything, any healthcare facilities or any other public, if they are harassed or anything, they cannot go to the law because they are themselves tabooed as a criminal because of something they are doing as illegal in this country. So making it legalized would only help them or empower them. So we cannot just stop it. They say for morality reasons such thing is not right and society may, but it is prevailing and we need to address it. So only thing we can by helping them is just to make it legalized so that at least they can get some help. And even in future generation or something, they can just get out of that work and do something, or even if they want to get out and do a job themselves, it will be helpful to them. So it is always better to legalize it. And I think there are few countries in the Western world where it is legalized and it is coming out much better. They get a health insurance, they have checkups. And so as such, the AIDS prevalence and everything has come under control. Because when they are illegal, or a lot of things is under the carpet. We do not know their data or any statistics. If we want to find do any intervention for them also.
So,
So
most of the female sex worker, I think, are doing it because of compulsion or poverty or
yes,
economic issues. So, if we criminalize their work, then they will themselves fear to get the government services or to avail the government services
service.
because they will think police will caught them or something like that.
Yes,
So, in this
even
way,
it may not be related to their work, yeah, and they
yes.
just need something simple. Also, they may be
Yes.
scared to come out because of their profession. Like if they someone gets to know, they may be legalized for that.
Mhm. So, Dr. Shruti, thank you for shedding light on this important topic of gender inclusivity. As we had a good kind of discussion where you told about there are different norms which are set up for both men and women. So it starts from there, from the birth only, and
Okay.
there is a difference between gender and sex. and people from LGBT community, the people who are heterosexual people or who don't belong to that community, they need to come forward and stand in support of these people.
Yes.
And when the government has to consider this when giving employment or some their services to this LGBT community. And there is a controversial thing about female sex workers is that we need to legalize their work so that so they can uh, they can avail the government service without any fear.
Yes.
So thank you, Dr. Shruti, for coming to our
Thank you.
session and talking about and shedding light on this important topic.
Yeah. Thank you.